the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako. Please can we give him a round of applause as he comes to take his remarks. Please keep clapping. You'll see him in just a minute. Okay, so we want you to take your opening remarks as the chair. Yes. You can use the mic and
Your Excellency, the Honorable Minister of Foreign Affairs, Your Excellencies, our First Lady, first let me recognize, well, I'm going to be partial today, the First Lady of unarguably the best state in Nigeria, Mrs. Bamidele Abiodun, and of course, the First Lady of the chairman of all the governors, so which means that is another very exceptional state, First Lady of Imo State, Your Excellency, the Ambassador of Mexico, the organizers of this very, very important event, gentlemen of the press, distinguished ladies and gentlemen. It is with great honor and deep appreciation that I stand before you today to chair this pivotal dialogue on adolescent health and well-being, hosted within the broader framework of the 2023 Gender and Inclusion Summit. Since its inception in 2022, the Gender and Inclusion Summit is fast becoming the leading platform to advance gender-responsive governance across Africa. I commend the Policy Innovation Center and the Nigeria Economic Summit Group for convening this transformative platform and also for their unwavering commitment for inclusive development over the years. The theme of this year's summit, New Voices and New Approaches for Accelerating an Inclusive Society, could not be more apt in our world where up to 32% of the population is estimated to be at risk of facing social exclusion, with the greatest percentage of 52% in sub-Saharan Africa. This theme is therefore a call for us to listen differently, act boldly, and collaborate intentionally to dismantle the systemic barriers that continue to hinder the health, rights, and opportunities of our adolescents, especially girls, who have been found to be more vulnerable to the adverse consequences of social exclusion. Our adolescents represent the heartbeat of our nation's future. Yet, they face disproportionate risk, such as child marriage, gender-based violence, limited access to sexual and reproductive health services, poor health habits, substance abuse, mental health issues, and barrier to public health interventions, such as immunization. These challenges are not just health issues. They are a reflection of deeply entrenched social and gender norms that shape behaviors, restrict choices, and perpetuate inequality. I am made to understand that today's dialogue also marks the official launch of the Nigerian Survey on Gender Norms, Attitudes, Health, and Wellbeing, a commendable initiative that is the first of its kind to systematically explore the norms influencing very young adolescents aged 10 to 14 across 5 critical areas of child, early and forced marriage, gender-based violence, sexual and reproductive health, human papillomavirus vaccination, and women economic empowerment. I strongly believe that the result of this survey will be instrumental in shaping policies and programs that are not only responsive but transformative. Let me use this opportunity to, on behalf of the federal government of Nigeria, appreciate the Bill and Melinda Gates Foundation for supporting this project. Let me take a moment to reflect on the strides that we have made as a country and as the Federal Ministry of Health and Social Welfare in advancing adolescent health and gender equity. Under the current administration, led by President Bola Ahmed Tinubu, GCFR, Nigeria has made commitments to improve adolescent health in the country, including ministerial commitments on global forums for adolescent health and in the West and Central Africa continent on education, health, and well-being of adolescents. We have continued to prioritize and commemorate the International Adolescent Week on a yearly basis, and the next celebration is scheduled to hold in the first week of October. I invite all of you stakeholders to join us in this celebration. Structurally, the Federal Ministry of Health and Social Welfare has an adolescent and social health branch with the Gender, Adolescent, School Health, and Elderly Care Division of the Family Health Department, and this department addresses adolescent health programming and interventions with a funded budget line for adolescent health development. Through the department, the ministry has developed and is implementing several policies aimed at adolescent health development, including the National Adolescent Health Policy, a clinical protocol on adolescent health and development, the National Guideline on Health Care for those who have experienced gender-based violence, a curriculum that we are using to train healthcare providers, among others. We have established an Adolescent Health Development Technical Subcommittee, which serves as a coordination platform to biannually review adolescent health interventions and programs for improved implementation. We have developed the National Adolescent Health Development Training Manual, which is being leveraged to build the capacity of frontline health workers at all levels of service delivery. Currently, the ministry is working with the EU to improve access to reproductive and adolescent health in Sokoto, Adamawa, and Kwara states, and best practices from this initiative are expected to be scaled up to other states of the Federation. In collaboration with the Federal Ministry of Youth Development, we have initiated a high-level national policy dialogue with adolescents at the center. This is to ensure that adolescents are not just beneficiaries, but co-creators of health solutions. In October 2023, the federal government of Nigeria rolled out routine human papillomavirus vaccination for young girls 9 to 14 years as a strategy to protect our adolescent girls from cervical cancer in the future. Led by Her Excellency, the First Lady of Nigeria, Senator Olurobi Tinubu, CON, we have so far immunized over 14 million girls, covering about 96% of the targeted population. Distinguished ladies and gentlemen, let me affirm that this initiative, itemized above, are not endpoints, as a lot more still need to be done. They are rather stepping stones and catalytic formula to leapfrog more commitment, additional interventions, and better collaboration to build a more equitable, inclusive, and resilient health system for Nigerian adolescents. As we continue this dialogue, I urge all stakeholders, government agencies, civil society, development partners, traditional and faith leaders, and especially our adolescent youth to commit to the following. 1, embrace gender transformative approaches that challenge harmful norms and promote the dignity of our adolescents. 2, strengthen multi-sectoral partnership to address the social determinants of health. Translate evidence into action by integrating findings from this survey into national policies, budgets, and programs. And finally, ensure accountability by ensuring mechanisms to track progress and amplify the voice of youth in decision-making space. Let me specifically call on our subnational government to demonstrate priority attention for adolescent health by establishing and funding budget lines to address adolescent health matters. Let us ensure that this dialogue is more than a conversation. Let it be a catalyst for change. Our joint aspiration should be to build a Nigeria whereby adolescents, regardless of gender, background, or circumstances, have the opportunity to thrive, attain his or her highest potential, and contribute to the development of our country. And so, with peace and plenty, Nigeria shall be blessed. Thank you all for your attention.
Thank you very much, Honorable Minister, for that beautiful remark, and amen to that last sentence there. Thank you, sir. Yes. All right, at this time, I would also like to invite for a very special remark, just before we get into the conversation proper, on the National Dialogue on Transforming Gender Norms for Adolescent Health and Wellbeing. Please join me to welcome the First Lady of Imo State and President of First Lady Against Cancer, FLAC, Our Excellency, Barrister Chioma Uzodimma. Can we please put our hands together for her as she comes for her special remarks? Please keep clapping until she gets here. Thank you very much.
Your Excellency, my dear sister, friend, and colleague, the First Lady of Ogun State, Her Excellency, Mrs. Bamidele Abiodun, Honorable Minister of Health State, the Ambassador of Mexico, distinguished policymakers, development partners, champions of inclusion, ladies and gentlemen. When I received the invitation to join this conversation, I was deeply moved by the theme, new voices and new approaches for accelerating an inclusive society. These words acknowledge that the old ways of doing things, while well-intentioned, have not been sufficient to bridge the gaps that continue to separate us from our full potential as a people. In Imo State, we recognize that inclusivity is not just a moral imperative, but a critical pathway to sustainable development. Under the administration of my dear husband, His Excellency, Distinguished Senator Hope Uzodimma CON, inclusivity has been prioritized as a cornerstone of governance. Being a strong believer in gender equality, His Excellency has given Imo women remarkable opportunities to serve and lead under his 3R administration. Imo State recorded a historic milestone with the appointment of its first female chief judge. Women also serve as commissioners, heading some of the most important and sensitive ministries and agencies, where they play crucial roles in shaping policies and delivering results. At the local government level, this commitment is equally evident as women occupy positions as local government chairman, vice chairman, and councillors, demonstrating his leadership in Imo State. It's inclusive and merit-based. We also have a female deputy governor, and a significant percentage of women hold key portfolios in the executive cabinet. These women are helping to drive transformative policies in education, healthcare, and economic development. Most significantly, we recently signed a disability inclusion bill into law, making Imo one of the first states in Nigeria to domesticate this important policy. Through my initiative, the Good Hope Women Flourish Initiative, we have reached over 10,000 individuals, of which more than 6,000 women and youths have been directly empowered across Imo State. Our interventions cut across health and wellness, education and child protection, economic empowerment and livelihoods, agriculture and food security, as well as mentorship and leadership development. Most recently, I initiated the Reaching Forward Mentorship Program, held 3 times a year, which connects young women and girls with accomplished female leaders. In the same vein, we stand firmly behind the National Women's Economic Empowerment Policy and its action plan. This strategic initiative is a vital roadmap designed to promote gender-inclusive economic growth, and dismantle the systemic barriers that have long limited women's potential. The policy aims to enhance women's access to finance, support their entrepreneurship, and create legal frameworks that protect their economic rights, ultimately adding billions of dollars to Nigerian GDP annually by closing gender gaps in economic participation. Imo State is committed to the domestication of this policy, and through my office, we will drive advocacy to ensure its full implementation. This work is not just about empowering women. It is about building a more prosperous and equitable society for all. Furthermore, my role as the current chairperson of First Ladies Against Cancer, FLAC, is deeply aligned with the mission of this summit to accelerate new voices and approaches for an inclusive society. FLAC is a coalition of current and former governors' wives working to improve cancer awareness, access to screening and treatment, and advocating for policies that ensure quality care across Nigeria. Our mission is to transform social norms that perpetuate gender inequality by ensuring that the most vulnerable, particularly women and children in remote villages and undeserved communities, have equitable opportunities for early detection, timely diagnosis, treatment, and care. We are committed to inspiring trust, mobilizing communities, and championing programs that dismantle harmful practices, such as early marriage and gender-based violence, which often leave women without a voice or agency. In this regard, I would also like to acknowledge a significant contribution to our shared cause. The First Lady of Nigeria, Her Excellency, Distinguished Senator Oluremi Tinubu, on behalf of the Renewed Hope Initiative, has donated 1 billion naira to the National Cancer Fund to fight the scourge of cervical cancer in Nigeria. She also made a passionate call to all Nigerians, especially women, to speak up and seek the help they need when faced with medical challenges. This call to action, delivered during her meeting with the National Task Force on Cervical Cancer Elimination at the Aso Rock Villa, Abuja, is an inspiring reminder of what is possible when leadership meets compassion and action. It is clear that sustainable change demands the collaborative, evidence-based approach that summits like this facilitate. The Purple Book should become a roadmap for transformation that governments and organizations across Africa will implement with urgency. This summit must amplify new voices, those of the marginalized, the unheard, and the undeserved, and forge approaches that unlock every individual's potential. The future we envision is achievable if we commit to being the generation that finally dismantles the barriers holding us back. Together, we can build an Africa where inclusivity transforms from aspiration to reality. I pledge my continuous support to this cause and eagerly anticipate the transformative outcomes of GS25. The time for incremental change has passed. The time for transformation is now. Thank you, and may God bless the Federal Republic of Nigeria.
Thank you very much, Your Excellency. The time for transformation is now. Very well said. Please, can we give her another round of applause as she goes back to her seat? We're still discussing, or the context, the plenary right now is the National Dialogue on Transforming Gender Norms for Adolescent Health and Wellbeing. I'd like to invite Mr. Isaac Oritogun, Senior Research Advisor at PIC, to set the context for this discussion. Please put your hands together for him.
Good evening, distinguished ladies and gentlemen. My task here is just to present sort of a background to the work we're doing on driving change across gender norms. Our objective is to identify the social norms that influence behaviors around our 5 thematic areas. Secondly, is to explore the intersectional factors such as gender and religion that affect the development of adolescent girls across these 5 thematic areas. Also, our goal is to explore the role of reference groups, considering religious leaders and traditional leaders as they try to preserve these norms and then change the negative norms that affect these adolescent girls. And then finally, our goal is also to investigate the gaps and explore opportunities to change regarding these norms. So what's our rationale? We understand that there's an urgent need to address these harmful norms and social and gender norms underpinning these behaviors because they remain deeply rooted in the fabrics of the society. Secondly, we understand that very young adolescents are neglected and there's a need to ramp up advocacy and interventions focused on them. And then finally, the opportunity for early intervention as early adolescence offers a unique window to preventing harmful norms from being entrenched and then ensuring that targeted interventions are crucial to shaping healthier and more equitable trajectories. Thank you very much.
Thank you. Thank you very much, Mr. Isaac Oritogun, for setting the context for us for the discussion. At this time, I'd like to invite the moderator for the discussion, who will then in turn invite all of the panelists. Please welcome with me Dr. Jennifer Anyati, Deputy Managing Director, Strategy, Technical and Growth, Society for Family Health. Please, can we give her a round of applause as she comes?
The Honorable Minister of State for Health and my own constituency, welcome. Of course, the First Lady of Imo State. Yesterday, and I don't know if the minister was there yesterday, they were talking about the numbers of people who are covered by health insurance in Imo State. And they said it's 2.7 million people have been covered by health insurance. So please, on behalf of the health constituency, please pass across our regards to His Excellency. So I'd just like to call now the moderators, the panelists today. The first panelist we have is Dr. Amina Dorayi, a very good friend of mine. She's the National Country Director for Pathfinder International. You're very welcome, Ma. And then we also have Dr. Binyerem Ukaire, who is the Director and Head of Department of Family Health at the Federal Ministry of Health and Social Welfare. I'm not sure I saw her. I don't know if she's represented. If she's represented, please do let us know. And then we also have Emmanuel Aja. Emmanuel Aja is the Country Director of Maristopes International, Nigeria. Again, an excellent panelist to talk about this issue. And then last but not the least, we have Dr. Habiba Mohammed, who is the Director for the Center of Girls Education, CGE. And she, of course, is going to speak very much to this issue. Thank you very much. And I know we're watching time. Did I see 18 minutes there? So I'm going to be quite strict on time. If I press my microphone, please know that it means it's time to round up. Thank you very much. can see there's a special moderator seat. Thank you very much. So you're all welcome to the panel. And we've heard from the Honorable Minister of State for Health. We've also heard from the First Lady of Imo State. And we've also heard from Population and Policy Innovation Center about issues around gender norms for young girls, especially young, very young adolescents. And so my first question will go to Dr. Amina. And so we're talking about gender norms here. And in 2 minutes, maybe you tell us a bit about, from your experience at service delivery points, how do restrictive gender norms show up when adolescents, especially very young adolescents, try to access health services?
Thank you very much, and thank you for having me in this very important panel. So very briefly, from our own experience, because we are almost always on the field in the service delivery points, and service delivery points mean where people actually receive care. It could be pharmacies, it could be clinics or hospitals in the communities. And so what we see is that, the fabric of those service delivery centers are actually gender biased. Why do I say so? I'll start with our hospitals, and I'll start with the structure of the hospitals. You'll find out that most often there are wards that are designated for women, for children, for males, for females, female ward and all that. But that unique group of people between that 10 to 14 especially, they don't feel connected to the children, and they're not really adults. And we don't have a ward that is specifically designed for them to even be free and to have a safe space in our clinics. So that is one. The second thing is that even when you go to clinic, the clinic days, you have children's clinic, women's clinic, you don't have adolescents clinic. That is really a problem, because that group of people have unique needs. Most of their needs are psychological. They have needs, biological needs, physiological needs that are not really, designed to be taken care of in our service delivery points. Then I'll talk about our health workers. Most often our health workers do not have that special training to address the needs of young people within that age bracket that have those specific health and wellness needs. And if you don't have that skills, there's no way that you can be able to address them, because we have, services for women, antenatal care, deliveries, we have children's services, we have postnatal care, we have neonatal wards, but there's none designed for them. Interestingly, especially for our males, someone in the other panel talked about males. The men, or rather the young boys that are really about to be men, they have that unique needs, and when they go to the hospitals, most of the healthcare workers are females. They are mothers' age groups, and they are afraid, because when they reach those hospitals, they know that there's some biases, that's expected of them, especially when they're about to receive sexual and reproductive health services. Unfortunately for us, we all know that even though the general, belief or traditional expectation is that these people are not sexually active, but we know that it's not rocket science. A lot of them are sexually active. So I would just like to say that even the data, we don't really disaggregate data by adolescent, that age group. We have children or adults, male or female, but that age group too, if we want to really understand their needs and where the gender issues are, we have to disaggregate that data. Policies are there, but the implementation at that level is what we need to all look at. But again, I would come back to the healthcare workers. The biases that our health workers have, it's really, really huge. Most often you don't know. Most of us have values, have beliefs, have perceptions that we grew up with. We don't know how it affects the next person. Some of our thoughts, especially when we are supposed to provide those services, we need to remove ourselves, remove our values, and provide service delivery, quality service delivery. And when we say quality service delivery, that has to be effective, efficient, equitable. It has to be timely, and it has to be patient-centered. That is a very critical one, patient-centered. It means every individual, no matter the age bracket, no matter the gender, no matter the needs, they need to have unique patient-centered care. Thank you very much.
Thank you very much, ma'am. Maybe taking a segue from some of your discussions, that there's an issue around some sort of stigma, to be honest. And maybe if we look at now to the country director of Marie Stopes, do you see stigma and silence around issues around adolescent sexuality? Do you think they block people from accessing the services they need?
Thank you very much, Jennifer. So, lots of what happens with adolescents is what comes from the level of stigma that is happening in the communities. From our experience, I mean, sometimes the worries will actually be, do we have the right places where the adolescents will go? But the bigger picture, or the bigger problem that we are facing is, even when these places do exist, the adolescents still find it very difficult to go there because they are often stigmatized. In the communities where you and I exist, or we have come from, it is believed that most of these adolescents, like Amina has mentioned, are not meant to be sexually active. And we do know that they are sexually active. And because they know that they will be stigmatized by just approaching a service provider in those locations, they decide most times to put themselves out. And pulling themselves out implies that regularly they will rather go to locations where they are not meant to go to, especially from untrained providers, and those are the locations where they often go and take up services. Thank you.
Thank you very much. At this juncture, I'd like to just invite Dr. John Ovari, who heads the Gender, Adolescent, School Health, and the Elderly Program at the Federal Ministry of Health. Is representing Dr. Okare to please come to the front. My apologies, I did not see you in time. You are very welcome. Thank you very much. Welcome, sir. Welcome, sir. Okay, so maybe I'm going to leave you to settle down because I've asked my next question to Dr. Binyerem. But Dr. Abiba, we all say, and that's something that we often say in the sector, that if we educate all the women in Nigeria, that all our issues will be solved. You know, the issues around health, and the data seems to suggest so. And so my question would be, what type of practical education-based approaches have you seen that could shift norms? You know, the First Lady was talking about transformation. The time for transformation is now. So what are those education-based approaches that could actually transform the gender norms that we've seen from this survey that are quite bad, and protect girls from child and forced marriage?
Thank you so much. For us at the Center for Girls Education, we support girls to enroll in school, stay in school, and complete schooling. And from what we do, our expertise is in safe spaces. And we provide life skills and intensive literacy and numeracy to girls in very rural communities and poor urban communities. Now, if every girl in every school, in every community, is able to have access to life skills and quality education, I believe we will not be here talking about early and forced or child marriage, because every girl will have what she wants to look forward to. They will have aspirations, they will have a future and a goal that is set for them that they want to see. So I believe that if the government of Nigeria and all other state governments are able to bring in these safe spaces, improving it with life skills, just like we have in the Agile project, every girl, wherever she is, will want to stay in school and complete schooling and be who she wants to be in life. Thank you.
Well, Ma, looking at it from your perspective, where do you think these girls could find the mentors that they need to provide them? For example, you're talking about safe spaces, and safe spaces are usually led by mentors. So from your own perspective, where could these girls, these very young adolescents, these girls in rural areas, where would they locate mentors that will be able to provide them with the support they need to address some of these norms?
For us, we train mentors, and the mentors we train are either teachers from primary or secondary schools, or people from the community that these girls come from. We train them intensively, and we retrain them, and we have review meetings every month so that we can be able to strengthen their capacity. And these mentors are people that these girls trust, because of the way they mentor them, the issue of beating. There is no beating in safe spaces, no use of vulgar language. We have safeguarding policies that guide the way the mentor works with the girl. And any girl that has gone through a safe space, you will find her confiding in the mentor, telling the mentor 101 things that she will never have shared with her own mother. So I believe if these girls have skills that ensure that they know that they have self-esteem, they can be able to trust other people as their mentors, and they can be able to bring out what they feel without fear of stigmatization or anything. I believe that this is one of the motivating factors that is allowing girls that have gone through safe spaces to be ahead of others. Thank you.
Thank you very much, ma'am. So, Dr. John, to you now. Obviously, a lot is being done, and I'm not sure whether you had arrived when the minister was speaking quite extensively about some of the work around adolescent health within the ministry, and I know you are heading GASHE. And so a quick question I have for you is, what programs is the government currently driving through your team, and of course linking to the states, that's addressing harmful norms, especially focused on very young adolescents?
Okay, so thank you very much, the moderator, and thank you, everyone. So for us in the Federal Ministry of Health, especially the Department of Family Medicine, so that department actually is positioned to attend to every member of the family, the adolescent inclusive, male and female. Now, in the Family Health Department, we now have the GASHE, which is the division that I head, gender, adolescent, school health and elderly. So most of the spectrums within the family are tackled there. Then, when we come to the aspect of the adolescent and school health, we have a full branch that tackles all issues and programmatic interventions that speaks to adolescent and school health age. Because we believe that at the Federal Ministry of Health, that gap, we should pick it up from the school health, preschool, and up to the school health and all that. So the programs that are there in order to make sure the norms are tackled, actually we work with partners. We have the National Adolescent Health Policy. In it, we addresses policy pronouncement and policy trust that helps to make sure we demystify anything that have to do with norms as it relates to the girl child. Then we equally have the sexual reproductive health rights policy of women and girls. In our own case, we included persons with disability in it because we believe that if the young adolescents are actually having some social norms that affected them, then those of them with disability are further disenfranchised when it comes to the norms that affect them the more. So that is also in place. And currently and presently now, we are already in the process of reviewing that policy. And we are reviewing it with the mindset that the sexual reproductive health policy in the ministry, which is domiciled in the reproductive health division, now that of the SRH should leverage on it, and then we have a policy trust for persons with disability and vulnerable population within that spectrum. And beside that again, in the GASHE division, we are not going to have a standalone strategy that speaks to the SRHR, sexual reproductive health rights of adolescents and vulnerable population altogether. So these are in place, and then we have the political will within the ministry in order to make sure this works. And that political will can be attested to the presence of the Minister of State, who is here actually to drive it. Thank you very much, Honorable Minister. Thank you. So the political will is there. So we'll be giving all the backing, and then for us as technocrats to ensure that we work in cohesion with our team. And the teams we work with, actually, with the organogram within the ministry now, we now have the RAMCA swap coordination steering committee. The RAMCA swap steering committee, the minister is sitting at that position, supported by the management team. And then we that are in the former RAMCA core technical group, we are now reporting to that particular steering committee. The whole idea is to make sure there's no duplication and wasting of energy and resources so that we can continue to provide information on how best we can do. And with the policy things that the current government and ministers are doing, you can see that we're already on the right path. I will speak more on it. Thank you.
Thank you very much, sir. We're jumping ahead of time, so I'm just going to look at, take one minute from each of the panelists, because I really want to give the Honorable Minister of State for Health an opportunity to kind of round up this session, and we are chasing time. So I'd just like to say, if you wanted to prioritize one thing, one partnership, whatever group, government, faith-based, youth groups, education, to accelerate transformative change for very young adolescents in gender norms, what would it be? Starting from Dr. Amina.
Thank you very much. So for me, I think youths, two things they need is confidentiality and trust when they are, in the health facilities or any of the service delivery point trying to access health services. So if that is the case, they will only trust themselves for now, because we haven't given them reason to trust us for now. It means that what I would prioritize would be youth-led, anything that is youth-led, any intervention that is peer-related, so that they will talk to themselves and they will be able to have, peers that they can trust, that can speak for them. And it also can be digitized. If we can get kind of a digitized mechanism where they can provide their feedback or their thoughts anonymously, that way we'll be able to even understand their thoughts, their needs, and the services that they require, so that we can be very prompt and apt with the services we deliver. So youth-led, youth-focused, nothing for them without them, and then digitization. Thank you.
Thank you very much. Okay, so Dr. Emmanuel.
So for me, looking at gender norms issues and recognizing the fact that they are multi-layered, it will be an approach that is all-inclusive, a partnership that involves practically everybody. The providers need to be involved, the community persons need to be involved, mothers need to be involved. Situations where silence will still persist in communities needs to be strictly avoided by an all-inclusive partnership mechanism.
Maybe I'd like to add, just to say maybe in 30 seconds, because I know I'm asking you another question again. How can service providers be accountable to young people?
So the service providers, we should be able to get them to pull away from being the ones who are actually pulling out our adolescents from taking up services. I know you said you said 30 seconds, but if I can just extend that a bit. In my earlier days when I started working with MSI, we had identified providers that were trained in a place like Aba and mobilized clients to go there. And a provider just saw a young lady and asked her, "What are you doing here?" And she said, "I came for family planning services," and she told her that, "I'm going to tell your mom." And that was it. She left there. Her friend that she would have mobilized equally to come and take up those services never came again. And we need to find a way to make sure we are engaging these providers to ensure that we break the silence.
Let me go to Dr. Abiba. Dr. Abiba, for you, what partnerships would you like to see to address gender norms?
I am happy that at this gathering today we have the Honorable Minister and First Ladies and other partners. I believe that if the government of Nigeria can take the life skills safe space component into every school, from primary to secondary school, for every girl and even boys to go through and get these life skills, I believe that we will not be here discussing this issue of gender norms or early marriage or whatever. Every girl will be able to get the skills that she needs to live a better life. And I always tell most of the men that any man that marries a girl that has gone through safe spaces and have acquired all the life skills will have no reason to divorce her. And I believe that. Thank you.
Thank you very much, Marcel. Of course, you're talking about partnerships between education, livelihoods, social development. I'm just reiterating what you said. Okay. Dr. John, partnerships. Which particular partnership would you love to see?
Currently now, we are actually implementing the EU SERA project and the EU's SERA project is an innovative initiative that is actually making impact. We have 3 states, Sokoto, Adamawa, and Kwara. We call them the SAC states. And the partnership is so rich that adolescents within these states, actually, the services that are being provided to them is strengthened. The facility where the adolescents go to access these services is also refurbished. And it's an integrated service provision that we are thinking of. Standalone adolescent health center may be too expensive looking at the economy. But when you have an existing PHC and you create a functional adolescent corner within that existing PHC, it's easier and cheaper. And when you build the capacity of the frontline health workers that are already there, using the government-approved training manuals that we already have in the Federal Ministry of Health, which we have done in these 3 states, is superb. And when we now encourage them to step it down, then the message, then also creating the awareness among the adolescents to access services. I think including them and planning with them and implementing with them. Thank you very much.
So like the adolescents will say, nothing for us without us. So again, the important role of engaging adolescents, there are lots of tools that many people have used to ensure that the adolescents' views are actually taken on board as we continue to design and address gender norms. I'd like to say a very warm thank you to the panel that's here. I'd just like to maybe reiterate 1 or 2 minor things that they said. Obviously, the recognition of adolescent health and, looking at both adolescents who are very young as well as the older ones, articulating partnerships, multi-sectoral partnerships, addressing stigma that drives very young adolescents away from primary health services, and then strengthened commitment to partnerships across ministries, the private sector, civil society, and development partners for sustained impact and transformational change. At this stage, I'd like to warmly once again invite the chair of this session, who is the Honorable Minister of State for Health, to come with his closing remarks. Thank you very much, sir.
Thank you very much, Dr. Jennifer, for a very wonderful moderation. And let me also appreciate the panelists for their very, very useful submissions. Clearly, our adolescents are the future of our society. They are the future Tinubus, the future Abiodun, the future Usodima, the future Salako, and so on and so forth. And so if we care about our country, we must prioritize their issues. Some of the key things that have been mentioned, I'll just highlight a few of them. Dr. Amina specifically speaking around how do we make our health institutions more adolescent-friendly, creating what specifically for them, ensuring that our health workers are better trained to be able to handle adolescent issues, and also even creating special clinics or specific clinics to be able to address issues of adolescents. I think these are very important suggestions that we must look at how to take them on board. Of course, they also talked about the bias of health workers, and I think that is very important. I had a very practical example when I was much younger in my secondary school, and I remember a lady then who missed her period, and all of us just concluded that she was pregnant. Even the health workers, Jewo Kiloshe, what did you do? Confess. I didn't know until I entered medical school that the stress of exams alone can make a woman miss her period. Those are biases. And even us as parents, we also go through these biases that we don't know. And importantly, most parents, and I think for most parents you will see, at that transition period from adolescent going to adulthood, most of us find it difficult to handle. And it is therefore important as part of our strategies to also look at how religious organizations, how communities can also counsel parents on how to deal, because when you talk about mentors, for example, the best mentor are still the parents. But if the parent doesn't understand, how can he mentor? So we must also look at that. The issue of stigma is also important. We should not just because of the age of somebody conclude that it is this way. Then I also appreciate the issue of life skills into our educational system. I think it's very important, and also encouraging schools to have a school health program that's able to support the issues of adolescents at school. So I think by and large, this is an eye-opener to quite a number of us. And as representative of government here, I assure you that a lot of those suggestions that have been mentioned have been captured. How do we ensure that there's confidentiality and trust? And how do we digitize? Because when you digitize, you make it more attractive to adolescents. So how do we do that? How do we build an all-inclusive partnership? How do we introduce life skills into our educational system? And how do we be more efficient by integrating services? Thank you, and God bless.
Thank you very much, Honorable Minister. But we'd like to take a quick photograph with you just before you leave. So please, careful.